You've been told about AVM embolization. Here's what actually happens in plain language in 2 minutes. An AVM is a tangle of blood vessels where arteries connect directly to veins, skipping the tiny capillaries in between. Without capillaries to slow the blood, vessel walls stretch and weaken over time, raising the risk of a brain bleed. Doctors commonly offer embolization after a bleed for disabling seizures or headaches, or before surgery or radiosurgery. Instead of opening the skull, an interventional neuroradiologist reaches the AVM from inside the blood vessels. General anesthesia is usually given. A tiny puncture is made in the groin artery, sometimes the wrist. Guided by live X-ray and contrast dye, a very thin microcatheter is threaded up into the vessels feeding the AVM. Once positioned, the specialist injects a liquid glue, tiny coils, or particles to block the abnormal flow. Other options include open microsurgery, focused beam radiosurgery, or careful observation for small unruptured AVMs. After the procedure, patients are watched closely in intensive care. A typical planned hospital stay is 2 to 5 days. Light activity often returns within days. Strenuous exercise and heavy lifting are usually avoided for several weeks. Risks include stroke, bleeding, or incomplete closure. Experienced teams and multidisciplinary review help reduce them. Follow-up scans confirm the AVM stays closed. A repeat angiogram is often planned 6 to 12 months later. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.